Yes, so yes, today we are going to discuss about the sickle cell diseases, otherwise it is also called as a sickle cell anemia. Okay, it is reported in 1910. It's mainly related to the autosomal recessive disorders, homozygous, otherwise the heterozygous inheritance pattern of the mutation of the beta globulin gene. So what is beta globulin gene? Beta globulin gene is a part of immunoglobulin, right? Immunoglobulin is made up of the four subunits, that is the 2 alpha, 2 beta. Since that beta globulin gene will be mutated, it is also known as a single base pair point mutation. So how come it is a single base pair? Because here you can see here GAG instead of GAG. So you can see the GTG change in the one single small nucleotide that leads to the change in the entire pattern of the amino acid. So amino acid here it is the glutamic acid will be normally it will be there in the normal like beta globulin gene, but because of this mutation, the glutamic acid is replaced with the valine, valine amino acid. Okay, so we'll go to the picture here, then you'll get to know about this. So this is a normal DNA sequences, right? Due to the mutation, so instead of the A, T8 is nucleotide is replaced, and the complementary base also changed. Then leads to the mRNA frame will be changed, and also the protein pattern here. Okay, so the normal hemoglobin will be like this 2 alpha 2 beta hemoglobin, but abnormal will be in the form of clamped hemoglobin. Okay, so now I'm coming to the genetic mutation to the hemoglobin causes sickle cell diseases, right? You can see at the primary structure of the amino acids, the linear structure of the normal hemoglobin is the secondary structure of the beta subunit, and the quaternary subunit. What we discussed that the hemoglobin is made up of the 2 alpha, 2 beta. So whenever they are in the normal, normal hemoglobin, they'll go and bind to the oxygen. So then they form the oxyhemoglobin. It will be circulated to the cellular organelles and cell tissue. Okay, so they will not associate with each other. But in case of mutation in the sixth position of the amino acid, the glutamic acid is replaced by the valine that leads to the change in the pattern of the subunit of the beta subunit of the hemoglobin. So you can see the different structure of the beta subunit of the hemoglobin. So all these four subunits they are associated to each other and they reduces the oxygen carrying capacity. Then finally leads to the anemic condition. Epidermology, this will be more common in the African countries and Arab countries and nowadays in India also. And it is more common in the UK and France and maybe due to the genetic drift, otherwise the founder repairs. So these are the main some of the causes why this is more into these countries. Now we're going to discuss the genetic pattern of this, phylogeny of the causes of this sickle cell anemia. So you can see the heterozygous sickle cell trait and heterozygous sickle cell traits. The father both are the sickle cell cases if they marry. Then leads to the heterozygous condition. It leads to the 25% of chances of the babies, like the offsprings. And so this red mark indicates that it will be the more prone to the sickle cell anemia. As I initially told, it is related to the autosomal recessive pattern. It is not related to the allosome. It is completely related to the autosomal pattern of the chromosomal inheritance, the chromosome 11. So in that mutation, it leads to the sickle cell anemia, otherwise sickle cell disorders. So what is the symptoms, the main symptoms of the sickle cell anemia cases? You can see that then they'll become anemic and severe pain will be there, susceptibility to the all kind of the infections. If it is in a normal shape of the hemoglobin, it will be in proper abnormal hemoglobin shape. Like you can see the sickle shape of the hemoglobin, and it leads to the they become anemic. So due to the chronic cases. And symptoms, usually the normal outpatient, they have 120 days for the lifespan, but sickle shape cells have less than 1 month, and severe pain will be there, swelling will be there, and infections to the all kind of the bacterial, fungal, and huge pain infection will be there, and growth delay will be there because lack of the RBC cells, and they'll become more anemic, and shortage of the oxygen carrying capacity, all those things that leads to the delay in the growth, the puberty, as well as the teenage. Okay. So now the vision problems will be there. Sometimes severe anemic it leads to the yellow fever, the jaundice, and the bone infection. All these are the some other advanced symptoms you can notice in case of the sickle cell anemia chronic. You can see that swelling in the hand because it will not clot and loss of the blood will be there. And now, after diagnosing this, we can go with the laboratory diagnosis for the sickle cell anemia. They'll do the blood test, right? They'll check the amount of the hemoglobin present in the sample, like both either both gender wise. They'll cross check with they'll have standard like value of the hemoglobin, and they'll go with the microscopic study. They'll check the structure of the hemoglobin. Then treatment, once they come up with the person is the like autosomal, like autosomal, otherwise a recessive pattern of the sickle cell anemia. So they'll first go with the pedigree analysis. So they'll take the family history in this, and these are the laboratory diagnosis test for the identification of sickle cell anemia. If you want to go with the the genomic studies, we have to go with the sequencing and PCR, the gene coding for that. So all this we have to confirm with the sequencing, then we can tell that the mutation of the cells to the sickle cell anemia. Now, treatment for this, as per the US, Food and Drug Administration approved the glutamic acid is treated for the patient those having the sickle cell anemia, because glutamic acid it is replaced by the valine, right? So we have to provide the L-glutamic pharmaceutically grade 1. And omega-3 fatty acids, they have the source from the fish, otherwise some dry fruits. They are rich of antioxidant, antithrombotic, and anti-inflammatory benefits. If you are like formulating with the omega-3 fatty acid, so we can secure the sickle cell anemia. And folic acid also like prescribed for the sickle cell anemia cases. And long-term transfusion, blood transfusion therapy they'll do, means because lack of the hemoglobin, they'll do the transfusion, blood transfusion from the same blood group. And nowadays, the initiation of option for the vasoconstructive trials. So these are therapeutic based hydroxyurea. These are the tablet based therapies they are going to treat the person. And finally, bone marrow transplantation. So this like the stem cells based work they are doing for the entire bone marrow. They'll replace that is a bone marrow transplantation, like organ transplantation, like how the kidney, liver, and all they do. So finally, the end will be the gene therapy. So gene therapy is the ultimate goal for the to cure the all kind of genetic disorders. Okay, so the gene therapy with the help of the retrovirus based method, if we replace the non-working gene, mutated gene, then we have to replace with the working gene. Then in that way we can, as a long term, we can cure these disorders. I hope this video it is clear about the sickle cell anemia. In next class we'll discuss about some other kind of the disorders. They are related to the one more also there sickle cell anemia, that is your what is that beta thalassemia. This is another disorder.